The Rural Communities Opioid Response Program, or RCORP, is a multi-year federal initiative that funds a range of grant programs to help rural communities treat and prevent opioid use disorder. Through support from the Health Resources and Services Administration's Federal Office of Rural Health Policy, many RCORP grantees have been able to grow and expand their services, reaching their community members where they are with the services they need.
So our community is very rural. So there's a limited amount of resources. There's a limited amount of access to healthcare services. So when we were seeing the issue of substance use disorder and so many people who were having overdoses or just could not find recovery support, we saw the need to reach out for additional funding to help support those individuals as well as their families.
What we hear so often is that from EMS providers, that we go and we revive people using naloxone, and then they refuse to come into the emergency department. Well, frankly, one of the reasons people refuse is because they've been there, done that, and they meet with a lot of stigma. So we also created a bridge from EMS directly to the provider. So somebody could call that bridge provider after they'd seen EMS and didn't have to go to the emergency room to access treatment. So that situation, when somebody is ready for help, let's find a way to get them that help that day and not wait until the worst might happen.
We do not have a detox center. We do not have recovery housing. We do not have mental health inpatient at our local hospital. So anybody who needs these higher levels of care are sent off the Eastern Shore. So what we found was we needed to empower the partners on the Eastern Shore to be able to provide services that are directly to the client to keep them from having to go to that higher level of care and having to leave the Eastern Shore, because you don't want to take people away from their support system and who is going to be there for them when they come out. It started from the planning network, the Rural Network Planning Grant, and that was awarded in 2020. And that really identified setting up the consortium as well as the partners that would be involved. We have a local health system, a regional jail, community college, a community service board, which does a lot of the clinical work. And through the work of that consortium with the first grant, we were able to identify the needs that led on to being awarded the Implementation 3 grant from RCORP, as well as a community paramedicine workforce for the EMS grant that was awarded last year.
We have 22 different organizations working together, leading the charge to reduce morbidity and mortality of opioid use disorder and also substance use disorder in our high-risk target counties. So they train as a requirement for employment every single employee of the school district, from the bus drivers to the kitchen staff to the teachers, counselors, maintenance staff. Everyone is trained in mental health first aid, and students have teen mental health first aid as part of their curriculum.
Our work with community health workers has added so much value. We've been able to place them in primary care clinics, on university campuses, within law enforcement agencies, and then also in outreach resource centers in our communities. They've been able to engaged with the community, being able to provide resources, connecting them to things such as transportation, healthcare services, medications, and also utility bills, getting those paid for them, as well as clothing, housing resources.
We focus on working with incarcerated inmates to educate them on addiction and help them get the tools for when they're released. So the peer support will meet with the clients while they're in jail and do the assessment of them to see what their needs are. And they begin working with them while they're still incarcerated to provide education.
Really what we do is we build the support system that they need. We give them the resources built in the support system so they have somebody to turn to. We really want to give them the holistic care that they need for a successful recovery.
This funding has allowed us to do so much. So many exciting things. In our RCORP implementation projects, I would say the greatest or biggest driver to our success and impacts so far has really led around connections, building relationships and partnerships in our rural communities. We are building sustainable community connections that are going to last well beyond this grant period.
Our stigma reduction work is really like a ripple effect. So if we're able to train or educate or increase awareness in one person, it ripples out into the community, everyone that they interact with, whether it's their patients, their loved ones, family members, friends. It changes their perception of those individuals and helps them to better support people in their community.
It gives them hope that they can change their life and that they can be successful because they're working with someone that has already done that.
There's this moment when you meet with people and it feels kind of like a victory, and it's a shared victory of them being pleasantly surprised that they connected with somebody, that this experience is already different than what they expected when they came to the ER.
We're a very small group, so we can only do so much. But whenever we work with others, we make those connections. It's almost like, the pot gets bigger. So those who are helping each other, it just spreads. So, it's not just us helping each other, it's the students helping the students, the peers helping those in recovery, providers helping providers. So it really does expand. The HRSA funding, it's definitely given us an opportunity to get back to our region, but it's also allowed us to identify other areas of needs and works that needs to be done. We're just getting started, but we are ready to keep on going.